So my name is Shana Coburn. I'm the psychologist for the Celiac Disease Program at Children's National. And today is really meant to be kind of the very first webcast where we talk a little bit about new diagnosis and what that's like and what people might be able to do to help cope with it a little bit better. So the first thing that I would love for you to do, if you haven't already, is to click on the poll to just tell me a little bit about what is bringing you here. Is it that you have celiac disease or gluten sensitivity? Is it that you have a child who has something like that? Or is there another reason that brought you here? So it would be helpful for me to just kind of know who's here. And so far I see that there's at least one parent. And definitely today is an opportunity for us to think about how we want to do webcasts in the future. So if we want to have them be more of social support where people get to know each other and meet each other and give advice, or if we'd like it to be more formal with me teaching and giving tips and people being able to ask questions and get some clarification from me as we go. So at any time, you should be able to type questions to me. So feel free to do that at any point. If you're having any technical issues, also please let me know. So, type if there's any issues hearing me, if you need me to speak up or anything like that. And it did occur to me that behind me is the setting sun. So if it starts to get too dark, I'm going to hopefully be able to use lights to make sure that I can show up. So it looks like some people have gluten sensitivity themselves, and some have a child with gluten sensitivity of some sort. So that's helpful. I have another poll I'd like to start. So this one is, did you see my presentation at the 2017 DC Gluten-Free Expo Education Day? So this is not because I, want you to stroke my ego or anything like that. I'd like to know if you've seen the presentation that I gave so that I don't repeat myself. Because I have some tips and things like that I'm going to share, and I can modify that based on how much you might have already heard. So go ahead and answer that when you have a chance. And while we wait for that to come in, I'm just going to take a sip of my drink. So what I want to do today is talk through just a little bit about the experience of initially getting diagnosed or having your child be diagnosed, and then what that typically experienced, what that's like for people when they initially are going through this. And of course, everyone's different, but I think the important thing is to open up the conversation and to make it clear that it's absolutely normal for things to not be as easy as it feels like maybe it should be. It's absolutely reasonable for things to feel difficult and for people to struggle. And the big message that I want to share, which is part of the title for today, is, things will get better. For most people, it gets better. That said, it's very helpful to ask for help when you need it, and that helps things get better even faster. So it looks like people mostly did not see my presentation, which is helpful to know about, so that way I can go through a little more thoroughly with things. So look on your screen, you also have a button that says slides up at the top. These are, it's basically a little PowerPoint presentation with slides that I am going to be talking through a bit. I might breeze over a few things, and so feel free to look through these at your leisure. And I'll kind of tell you as I go through different things. You don't have to follow along with the slides, but you can. And they're helpful to look back on as well. So I'm just going to talk a little bit, and then I think we can do a little more question and answer and see if there's any additional information that people, would like to learn or would like to share. So, kind of the first slide after my title screen on this presentation shows a ton of the different things that we go through when we have a new diagnosis. There's a lot to learn about. The learning curve is extremely steep, and there's a major obviously, because usually people start off quite sick before they get diagnosed. Now, some people luck out and they're not quite as sick as others, but of course, we usually are having symptoms or having issues in our body that make it hard for us to actually be able to cope with things that might be more difficult in our lives. Once we get a diagnosis, there's a lot to learn about. There's a lot to cope with in terms of the idea of even getting the diagnosis. And it can be challenging to find foods that you're enjoying. It can be challenging to feel comfortable eating foods. And this is especially true when you have young children who don't fully understand what's going on. But even if you have teenagers who are trying to be like their friends and fit in with everybody. So this can all lead to emotional overload. There are many, many reasons why people can just become so overloaded that it makes them want to shut down. So it's important to recognize that this is common, and I'm here to guide you through this a little bit. And our program is here to guide you. If you're a patient of ours, help walk you through the process, and just recognize it will get easier over time. So moving on to my next slide, there are many reasons why the gluten-free diet is stressful. This is true for a gluten sensitivity or for the children, and definitely for their parents. So in fact, the younger the children are, there's data that shows that it's actually increasingly difficult for parents of the children compared to children themselves. So the good news is you're probably protecting your child from stressing too much or worrying too much. But the bad news is that you're probably taking on the burden as a parent. So that's something to recognize and be aware of. And I'm going to give you some tips on how to manage that, both for your child, but also for yourself as a parent. So there are many reasons to be stressed out. There are often symptoms in your body or in your child's body that are, continuing to be problematic. They don't resolve overnight for most people. So that's stressful in and of itself, trying to manage the symptoms when they're unpredictable. But in addition, coping with the idea that there is a chronic illness that is not going away, that you're not going to be normal. And there can also be guilt about waiting too long before the diagnosis or not making the right decision about things. And often this is really not helpful and probably not true. As a parent, you probably didn't do anything wrong. And as an adult, it's hard to care for yourself sometimes. So either way, that guilt is understandable, but probably not based in anything where you should beat yourself up over it. Social relationships can be impacted dramatically. Same with just general lifestyle changes that you have to make. And there are many temptations out there. So that adds stress because every day there's that thought potentially of cheating, of trying something that you wouldn't normally be allowed to eat. But the flip side is you're also having to pay attention and try and protect yourself. So there are many different reasons that this can be a burden on our well-being. So if I move to my fourth slide, I go into a little bit of detail just about some traps that we can fall into. So one thing is thought traps. And the idea of thought traps is that these are unhelpful ways that we think about the world, think about our life, think about situations. And a lot of the time it's unhelpful to us because it's exaggerated or it's more negative than maybe a balanced view that we might be able to have. And also sometimes we blow things out of proportion. We might predict that things will happen that we don't know will happen, and they might seem like they're going to be much worse than maybe they actually are likely to be. On my next slide, we've got anxiety. So let's talk about anxiety for a minute. Anxiety is a normal emotion that everybody experiences. It's protective. We've all grown, as a human race to have anxiety because it helps us stay safe. If there's a threat, if there's a car about to hit us, even back in the jungle, when trying to protect themselves against animals, if you see a tiger eyeing you through the bush, you want to make sure that you can run away or fight that tiger. And so anxiety is very helpful for us. But sometimes we have anxiety over things that are not as big of a threat as it feels like. And it might not be helpful to us at all times. So we want to keep our anxiety in check and become aware of it. So on my next slide, we talk about anxiety in the body. So in the body, when we have that kind of fight or flight reaction, there are many different systems that get activated. And it can be good because it makes us respond and think carefully about things and be able to act, but it also can cause many different physical symptoms that make us feel ill. And in many times, those symptoms mimic symptoms that we might also experience if we're having a reaction to gluten in some way, if you have symptoms. So if you think about that, when you get nervous about something, it makes you feel kind of sick. It might contribute to more anxiety because you start to worry, is it because my body is sick? Is it because I've had a reaction or I'm about to have a reaction? And it can create this downward cycle that can be paralyzing. And the same can be true with children. So children can be scared of sensations in their body. Parents might be nervous about the sensations their children are having. And sometimes the children can't explain exactly what they're feeling. So parents are maybe getting nervous themselves and potentially accidentally increasing the anxiety, not only for themselves, but with their child. So this, again, can take us in this kind of snowball effect. So what happens when we get too anxious? On my next slide, I've got avoidance. So when we have to make big changes, when we have a threat, that can be very scary and it can make us avoid situations. But that can really shrink our world down. And this is not helpful for us. If we avoid things we're scared of and we don't manage it and problem solve proactively, avoid things that maybe we could otherwise have tackled, and this can create more distress for us. So avoidance is something to be very careful of, be very aware of, and especially in children. If children don't want to go to school, for example, which is very common, we really want to be encouraging them to push through the temptation to avoid things and instead face them head on. This can be really challenging, so I'm going to talk a little bit more about this. So on the next slide, I have a list of some coping strategies. All of these coping strategies I'm going to talk about are difficult to master, but most people can learn them relatively easily. And especially if you have a little bit of help, it's more doable. So a lot of the time it's very personal. You have to kind of explore the different strategies and see what works for you. And sometimes having help with a therapist or some kind of other professional who helps with relaxation or planning or different aspects of your life that might help you manage some of your feelings. Sometimes it's just a loved one who can really be helpful in being a partner in kind of helping you start to cope with things. So there's several different coping strategies I'm going to talk about. One is changing some of those thinking habits. Learn to accept some of the physical symptoms we're having. And we want to find some balance. Oh, it looks like we've got one question. So let me just take a quick peek at this. Okay, so we've got a couple questions. One of them, this is very relevant. So the first question about explaining, I'm not sure if you can all see the questions that are up here, but I think you can. But the question about explaining how important it is to stay safe, I'm going to address that a little bit later on. If I forget, please let me know. But the other question is, if my daughter accidentally eats gluten, can she feel anxiety as a symptom of celiac disease? So that's a great question, and it's actually to answer. The short answer is yes, absolutely. Anxiety can come up for many reasons. One reason is that your body potentially is having an immune response. And there's a good amount of data that shows that an immune response in the body, especially in the gut, can potentially increase anxiety for people. We don't exactly understand why, but it's this fancy gut-brain axis connection that we think occurs, but we still are learning a lot about that. There's a lot more to learn. But in addition to that, sometimes just the experience of worrying that maybe you've eaten something that's made you sick, or B, feeling sick and then trying to cope with that. But either one of those things or both can create anxiety as well. So if you get a really bad stomach ache, or if you get a really bad symptom, or you're starting to have a symptom, it's easy to then get anxious about it. So like I said, with the physical sensations, creating this downward spiral, if we are having a reaction, sometimes that can create a reaction in the body that that makes us kind of even more uncomfortable. So it can intensify a reaction that's already going on. And there are strategies where not only can it manage anxiety, but it can manage the physical symptoms regardless of what's causing it. So even if it's a physical reaction, having some of these strategies to cope with the physical symptoms is helpful regardless. And for the most part, I would tell people it might not even matter to know what caused that symptom. So maybe you have a stomach ache. Okay, let's just move with that. Let's just accept that there's a stomach ache and let's figure out how to cope with that. It's easy for us to try to investigate and think back on exactly what caused it, whether it's I was too nervous, I had a panic attack, I ate bread, whatever is going on. But in the end, this is the experience, and accepting it and kind of moving forward can be really helpful for people. So I'm going to talk a little bit more about that in a minute, but again, you know, it's trying to learn to accept those physical symptoms. So it's managing the physical, whatever it is that's going on in our bodies. And I'll talk about that a little bit. Finding balance is something where we're learning to be vigilant and careful, but also live our lives. And that's a challenge, but that can be really helpful. Trying different relaxation strategies, learning to bounce back and be resilient, and learning some practical skills can all be useful. So, and I see another question here about psychologists and things like that. I'm going to talk about that at the end. So I'm glad people are asking about that. So first, let's talk a little bit about changing your thinking. So changing your thinking is something where we want to be aware that we're worrying about something. So if you take a moment and just think about what are you worrying about with this diagnosis, and you don't have to tell me, but just think about it to yourself. What are you worried about? Ask yourself, okay, so with that situation, what's the worst that might happen? And I'm sure it's really easy for you to jump into all of these awful scenarios, right? And I'm sure that's going through your mind all the time. But give yourself a little reality check and ask yourself, what's the likelihood that that would actually happen? So for example, if I eat, you know, a serving of gluten and that makes me violently ill, if I then go to a restaurant and I'm trying to be gluten-free and I'm trying to advocate for myself and I don't know what the server is giving me, what's the likelihood that I will become violently ill? It feels like, oh, it's so easy. The server could give me a serving of gluten, I wouldn't know it, and I could become violently ill. That's extremely likely. But if you practice and if you're advocating and you're asking the right questions, chances are you're not going to get that kind of exposure most of the time. So if you don't have such an extreme exposure, what's the worst that would actually happen? Maybe, sure, the worst is I could become violently ill, but if I get a small amount of gluten in my system, what might happen in that situation? Maybe I'll feel a little bit off. Maybe things won't be perfect. In the end, even if the worst happens, how bad would that truly be? These are all extremely difficult things to practice, but to really explore that, why am I so scared of that situation? And even when it comes to anaphylaxis, I've worked with families where there's an anaphylactic allergy, and that's very scary. But for most people, when they have a safety plan, when they carry an EpiPen, when they know where they're, how they can reach the closest hospital, worst case, even with anaphylactic reactions, there's not necessarily a huge risk of death. So it might not be good, might not be fun. We want to try to avoid it. But in the end, a lot of the reactions that we might deal with, or a lot of the scenarios we might deal with, are not as bad as they feel. So I'm seeing a lot of questions about different types of psychologists. So I'm going to take a moment to talk about that. And certainly, if we prefer to just do questions and answers, I can definitely do that as well. So let me know if you'd like me to continue to go through different strategies, or if you'd rather I answer questions. So for now, I'm going to answer some questions. The first question, I guess there's two questions about psychologists. So one is, my son has celiac, but I think I'm the anxious one. Are there adult psychologists to help parents cope with their child being sick? That's a really great question. And it's a little complicated because I think it depends on the psychologist. So in my situation, I'm a child psychologist, but I work with the whole family. And this is true for most child psychologists. So in a situation where your child's been diagnosed, but you as a parent are really struggling a little bit with this, there are situations where it makes sense to be working with a child psychologist, because in the end, the way that you as a parent are reacting to your child's situation affects your child, and it probably affects the way you're parenting your child. So that's kind of where the adult and the child areas can kind of overlap. If you're struggling with figuring out how to parent your child, anxiety take over, or if you're finding it really difficult for you to make decisions that are helpful for your child because you're too worried about things, you can certainly work with a child psychologist to talk through some of those fears and come up with some strategies for how your child can kind of live the most productive, successful life. So certainly that's one thing that you could try to do. There are certain, I would say, if you find that you have a lot of anxiety that's not just stemming from your child's celiac disease or gluten sensitivity, if you're starting to notice, wow, I've got some of my own stuff, maybe bigger than just that I should work on, then I would recommend finding your own therapist that works with adults and not necessarily focus only on your child, but try to think about the other things that might be coming up for you. And the bottom line is that food is emotional. Food for a lot of people is very related to love, and it can bring up a lot of our emotions about the way we were brought up, about our family, about our culture. So it is worthwhile to do a little bit of introspection and think about how it's affecting you. So you can certainly work with a therapist. It doesn't have to be an expert in celiac disease, but you could definitely also work with a therapist who, kind of deals with children and families. So in my situation, I would definitely work with a parent who's having any, anxiety about this kind of stuff. And I think if the anxiety was stretching beyond that, I would probably suggest them finding their own therapist for that kind of stuff. So if you are a patient of ours or are interested in that, you can certainly contact me, and my information's on the last page of the slides, but I can also give it to you again. It's Coburn, SCOBURN, at childrensnational.org. So you can definitely email me and we can talk a little bit and see if it's appropriate for me to see you for therapy. Or I can always also just try and help find somebody for you to also see. And so the other question was, are there psychologists that work with an entire family? Only one of my kids has celiac, but it affects my older daughter just as much because she has to eat gluten-free. And so really similar to the answer that I just gave, absolutely, if it's affecting the family, which it commonly does, it's very normal for it to be a family effect, right? Everyone is adjusting. Everyone's trying to figure out what they're supposed to eat, how they're supposed to handle eating gluten in front of the person who's diagnosed. And in that situation, working with a child psychologist is very appropriate. So again, I would work with a family where maybe there's a sibling that's struggling with that. Again, if there are other issues that start to come up, other family dynamics that are bigger and different than the celiac aspect, that's when maybe formal family therapy might be a better scenario. And then you could just find any family therapist. But definitely if it's coming to the food situation and celiac and the relationships related to that, then that would be a great way to work with a family. Another great question. Child with celiac need a psychologist? And resoundingly, the answer is no. Most children and most adults and most parents do not need a psychologist. So then why do I have a job? A lot of people find that it's difficult when they first get started, but they can learn to cope with it on their own. It doesn't mean that they have to do it on their own. So psychologists can be very helpful, but it's not necessary. Many people can make this shift and learn to manage their life very successfully without much problem. And the majority of people do. So there's definitely an increased chance that things are more difficult for people who have celiac disease and gluten sensitivity, especially at first because it's stressful on people. But it doesn't mean that most people have mental health problems over it. It can be stressful, but most people cope with it, work with it, and make it to the other side, and it starts to get better for them, on their own. It's, I think, when you start to really feel like it's interfering with life, it's making people want to avoid situations, it's making people overwhelmed and terrified to travel, to order at restaurants, to buy food, to eat enough food to feel satiated and healthy. It's situations like that, as well as if someone's not succeeding in following their diet very well, psychologists can be really helpful. And the other question, will my child feel upset if I take them to a psychologist? She's so on edge about food, but I don't know how to get her in the door. This is a great issue that comes up all the time in my field. There's a lot of stigma attached to psychologists. So there's a couple things. One is most children don't know what psychologists are. And so that can work to your advantage because there isn't really a stigma if you don't know what we are. And usually what I explain to kids when I first start working with them is that it's my job to learn about them and help them come up with ideas and ways to help them live their life as best they can, to be as happy as possible and healthy as possible. So it's really meant to kind of be a coach who's there on your side, who helps you come up with strategies that helps you get through the challenges that are going on in your life. Now, if your child is maybe on the older side, is aware of what a psychologist is and is like, doesn't want anything to do with it, that is something that's challenging. And the best thing that I can suggest for that is to ask them to come once, and that they do not have to talk about anything they don't want to talk about. That's the first thing I always tell kids or anybody is, if there's something you don't want to share, just tell me you don't want to talk about it and we won't. So that's the biggest thing. The other thing is that for kids, especially who don't really want to talk about stuff, that's totally normal. And so child psychologists, and including myself, have a lot of strategies that don't relate to talking. So talking through stuff is not always helpful for kids. Sometimes it's playing, sometimes it's writing stories, sometimes it's reading books. And, over time, there are lots of different ways through play, through interaction, through little bits and pieces that kids can deal with some of their challenges. There are a lot of different kinds of strategies, and child psychologists are usually very creative about that. So the best thing you can do is reach out to a psychologist and ask them for suggestions if your child's really against going. Ultimately, you do want your child to be willing to participate, but they can't make up their mind about that until they're in the door. So I would really encourage that you have them, one way or the other, try to encourage them to go just once. And if they absolutely hate it, then maybe that's a discussion you can have with them about what happens next. But asking them to try it out is really helpful, because a lot of kids find, oh, that was actually kind of fun. Or, oh, like I got to talk and complain about my parents to this person who's not going to go tell them. So a rule that I have is that I ask parents to give us privacy. And there are certain situations where if there's a legitimate safety concern, something that I think is really important for parents to know about, I absolutely have to, I'm required by law to share that if there's any safety risk. But I ask parents to try to respect that I need to form a relationship with the child, especially if they're a little bit hesitant to talk to me and connect with me. But again, it really does vary depending on the family and the child. So sometimes if a child's really nervous or doesn't feel comfortable and they prefer a parent being around, maybe I'll see them together with their parents. So it really does vary a lot depending on the situation. So the other question is, how much does it cost to see a psychologist? This is also a really common question, and it unfortunately doesn't have an easy answer. Psychologists come in all shapes and forms, and you have to remember also there are lots of different types of therapists. So psychologists, in order to be called a psychologist, they must have a doctorate in psychology and they must be licensed. But there are other types of licensed mental health professionals, including clinical social workers and marriage and family therapists and counselors, who also have varying degrees of training. and they can be highly qualified as well. They might not necessarily have as specialized of skills in certain areas, so they may not be as aware of specific types of chronic illnesses, but that's not always true. So it's really finding the right fit. And some therapists have sliding fee scales that are, you know, based on your income and your ability to pay. In our situation, we have a program, the Celiac Disease Program, which has donor funding. So with me providing therapy, if anyone is ever struggling to pay, there's always the ability for us to help cover those costs. So I wouldn't, especially if you're interested in coming to Children's National to work with me, I would encourage you not to let costs interfere with your trying it out and seeing how things go. The other thing that I'll tell you is that from my perspective and many other child psychologists, not all, but many of us, especially those of us that are oriented towards, you know, thinking and behavior. So it's called cognitive behavioral therapy. We tend, not always, but tend to set goals and really try to find ways to make important changes. And once we see that the changes are starting to be made, we want our patients, our clients, to go off back into the world and be independent. So it's not a lifelong psychoanalysis process. Certainly some people choose to do that kind of path of therapy. But the type of therapy that I give, especially when people are first diagnosed with celiac or gluten sensitivity, is usually we set a few goals, and the plan is let's meet every week for a month or two and reevaluate and see how things are going. And many people only need to come in for a couple of months, and then they get a lot better. Some people might find that they have a lot more stuff coming up as they go, but that really does vary depending on the family. And most of the time I try to minimize the burden of having to come in all the time. So it might be every week for a month or two, and then maybe it's spreading it out a little bit further apart and seeing how people do when they have a little bit less frequent appointments. So I think that that is it in terms of the questions. I do have another poll that I'd like to start. So this one is, what do you feel is the hardest thing about celiac disease, gluten sensitivity, and the gluten-free diet? So just, you know, a word that comes to mind or anything that you find to be challenging about the gluten-free diet. And while we wait for people to give that answer, and until I see any new questions, I'm going to continue talking a little bit about different strategies. So, oh, and I see one more question. Okay, so let me, since we have a lot of people who are concerned a little bit about school and things like that, I'm going to start talking just a little bit about parenting your children. So that's towards the end of my presentation in terms of the slides. If you're following along, it's the 17th slide. So the number one thing I would recommend to parents of kids who have a gluten sensitivity is make sure to be mindful of your own reaction, right? So we've talked a little about parents having some of their own anxiety, and try to make sure that you're managing your own feelings on your own and not letting that influence your child too much. One of the hardest things to accept is that exposures to gluten will happen. It's just inevitable. This is true for everybody, and it will be okay. It's not going to continue to happen for most people. It's usually accidental. And you want to be careful not to avoid things if an exposure happens. So it's sort of the whole get back on the horse situation. If you have a young child with a gluten sensitivity, it's really important for you to manage your guilt. So don't worry about anything you did. It's not your fault, trust me. So your child doesn't have a gluten sensitivity because of anything that you did, anything that you chose to do, any, you know, medical advice. Try to let that go. It's easy to worry about that, but really it's not helpful. And the reality is we have no reason to believe that parents' decisions are causing any of these challenges. Having a reaction or is not feeling good, the best thing you can do when they're little is just to be present with them and help soothe them. As they get older, the big thing is they're going to be confused about why they can't eat some of the food that other kids are eating. So you want to be firm about them being able to eat certain things and not others, but give them choices when they can have choices. So maybe, oh, you can't have that cupcake, but we have this gluten-free cookie or this bag of chips. Which would you like? And that gives them a little bit of a sense of control, and that's very helpful. Also, we try to use positivity. Try to always tell them, look, these are the things you can have. Don't focus too much on the stuff that they can't have. Yes, you want to acknowledge that sometimes that's difficult, but try and turn that around to something positive as quickly as you can. For school-age children, you want to make sure not to let them stay home sick unless you really are certain that they're very, very ill. Of course, if they have some kind of infection or something that's contagious, that's another story. But if they're having symptoms that you think might be related to gluten exposure, if they're not seriously ill, just send them to school. It's much better off for them and for you. And worst case, if they get really sick at school, they come home. And I think, again, the important thing is not to let that become a terrible thing. It happens, we accept it, we move on. And you can also help your children advocate for themselves. When they get into school, teach them how to ask some questions, teach them how to read labels. It's really important to let them know that they didn't do anything wrong. So same as you telling yourself, I didn't do anything wrong. Your kids need to know that they didn't do anything wrong. They're not being punished. This is just something that some kids have, and it's going to be okay. As kids get older, they're going to want to feel normal. They're going to want to fit in with their friends. So it's important to try to give them those opportunities when you can and try to help make adaptations as needed. And also continue to encourage that they advocate for themselves. So encourage that they get better at ordering food on their own. You're going to want to keep monitoring them, but try to give them a bit more freedom and see how they do with that freedom. Once they get to adolescence, this is a scary time. They are about to enter adulthood, and ultimately they're going to be responsible for their own care and their own well-being. So this is a time when they're teenagers to try to have them give them opportunities to build your trust and help them learn to become more independent. It's extremely common for middle school through adolescence to for these kids to want to cheat on their diet and like sneak pizza or whatever that their friends are having. This is normal. This is the rule, not the exception. And the best you can do is try to encourage them to make helpful choices and help them recognize some of the negative consequences of them eating these kinds of things. If you're finding they're really cheating on their diet a lot, that's a good time to bring them into a therapist who might be able to help them and you manage those decisions and reward them a bit for the positive decisions. But don't forget about all the other things that kids go through. There are a lot of other issues in their lives that they go through just like every other child. So don't let this consume your life. There's a lot of other things that you need to be parenting them on. So it's just one little aspect, and you can treat it truly like a lot of your other rules if you need to. So keeping to your gluten-free diet can be similar to, keeping your room clean. And sometimes that's the best motivation you can give them. So let me look back at some of these questions. So how do I know if my son is having emotional issues at school? Would the teacher tell me? Do I ask? It's very common for parents to not know. In fact, I think most parents don't know if their child is having emotional issues or not. If it's extreme, school would tell you. So schools and teachers are used to seeing this kind of thing. And if there are really extreme problems going on, they will let you know. This is especially true because it's usually disruptive to the class, disruptive to their success in school. If they can't focus well, things like that, they're probably going to raise that and bring that to your attention. So if you don't see signs of it and if you haven't heard anything from teachers, chances are they're doing okay. But if you have concerns, you can always ask the teachers. Or if you've noticed emotional issues at home, you can always raise that to the teachers and say, hey, could you keep an eye open for this? Let me know if you're noticing this. And I think the most you can do really is have open dialogue with your kids from whatever age, just ask them, hey, does it make you feel kind of sad that this is going on? Or, did you have a rough day? And just make it okay. And it doesn't have to be the most serious thing. Sometimes it's the quickest little conversation, but keeping that conversation open can be a really helpful process for people to be able to to be able to move forward and feel connected to their kids. So some of the things that people say are the hardest thing about celiac disease and gluten sensitivity, gluten-free diet is eating out and travel and contamination. And this is a really common trend. This is something that a lot of people share. So it's really normal to be concerned about this sort of thing. And this occurs for people throughout the process of being gluten-free. The best thing that I can offer is that it's over time, you can learn a lot of different ways to ask the right questions, recognize restaurants that are maybe going to be a little more friendly to the gluten-free diet, and avoid potential contamination. So I didn't mention this, but I have celiac disease myself, and there's certainly certain types of foods when I eat at restaurants that I'm less likely to order because I've had multiple situations where I've ended up sick from it. And it's not necessarily the restaurant's fault, but I've decided, you know what, rather than me eating pasta, for example, and this is not to say that pasta is not safe, but like pasta, and I find a lot of the time, you know, one potential threat is that they might boil it in the same water that regular pasta has been boiled in. It's tough to find that out. So sometimes for me, if I don't want to kind of worry about it, I'll just order something that I feel a little more confident is less likely to have contamination. And sometimes it depends on how important it is for you to be healthy that day. So if I'm traveling, I might be less likely to order the pasta than if I'm home around the corner, you know, going to a restaurant. So maybe an alternative would be ordering like vegetables or something like that. Or maybe it would be getting a certain type of soup or, you know, salad that I already knew was pretty safe most of the time with other things. So, and same with different kinds of sauces, you start to learn to ask the right questions. And a lot of our classes and informational materials that we have on our app and on our website have a lot more detail on different questions that you can ask and things to look out for. So those skills will come over time. If you're early in the process, it just does take some practice, but it will get better. And it's a common thing that you just sort of learn to manage over time. So we're getting close to the end of our hour. So I want to now ask a couple final questions about what we want this to look like in the future, assuming that you might want to tune in again in the future. My plan is to have a monthly meeting for people who are still coping, and especially those who are newly diagnosed. So that way people have a kind of a safe place to go to get information. So I'm going to activate this next poll. So which of the following types of things are you interested in for future webcasts? So today I kind of did a hybrid where the only thing you're looking at is me and the polls, but in the future we might be able to do something where you might be able to talk with one another. You know, some people want to feel like they can get connected with other families versus getting more information. So, you know, I gave some of the kind of typical talk that I would give under other situations, but a lot of the question and answer I know is valuable as well. And okay, so it looks like people are so far saying educational lectures and receiving advice are things that people would want the most of. And I think, you know, an important question is just whether there's anything else that people might be interested in. So I'm going to give people a little bit more time to vote on these things. I've heard a lot of people, especially when they first get diagnosed, they ask about support groups. And that can be very helpful. It doesn't necessarily have to be moderated by somebody like me, though. So there are a couple options. You know, I think for the webcast, the purpose is that it's a little bit more accessible for people and we can record it and then it's available for people in the future. But there are also situations where we could have people communicating on a one-time basis and being able to chat with each other. And we could either connect people ourselves or we could give people contact information for each other if they're interested in that. And of course, that would only be if they gave us their information. But alternatively, if people are having their own issues and concerns that they want help with, and they want to get advice from other family members, other parents, other patients, that is an option as well. So far it looks like a lot of this is similar to the title that we gave this of, ask the psychologist. So it looks like receiving advice and having questions answered is the most preferred thing for a future webcast. So certainly we can do that where it's a little bit less formal and I'm just here to answer questions and you can bring concerns. I think the big thing that I would recommend is if you do have some of the concerns, like what's been asked tonight about, would a psychologist see me for this purpose, or are there specific ways that I can do X, Y, and Z? The best thing to do really is to reach out and ask to see a psychologist. So I'm available. I have specifically right now, I'm seeing, if you're in the DC area, I see people on Thursday afternoons for individual therapy. So definitely if you have a diagnosis, I can talk with you a little bit on the phone to see if it seems appropriate for you to come in and chat with me. And that's definitely one option. The other thing is we have a multidisciplinary clinic where we have the gastroenterologist, a nutritionist, myself, and then we also have, our education people and neurology and all kinds of different people basically to all gather together and learn about what's going on for you and give you recommendations all in one day. So that's another option as well. And so I can also connect you to that information. So if you have any questions or interests, absolutely don't hesitate to reach out. The best way is through email. So again, it's the last slide if you click on slides, but it's SCOBURN@childrensnational.org. And I'm happy to just kind of do a little screening with you and see if that would be helpful for you. And certainly some people come once or twice and they feel like it's not really necessary, or I'm doing okay. Or maybe they just need me to tell them, you know what, I think you're doing okay. You don't really need me to say that though. So if you feel like you're okay and things are a little challenging, but you're getting through it, you probably are. So try to be confident with that. Reach out to your family and friends, find a support network. A lot of the time you can just meet some other people going through similar stuff and really bond with each other. That can also be very helpful. But if it's really difficult to get through things, if you're feeling overwhelmed, if you're finding your child is trying to avoid situations or you're avoiding situations and it's shrinking your world and it's making things more challenging, then that's a really good indicator that it's maybe time to talk to somebody, with a little professional expertise to give you suggestions on what you can do to help make your life a little bit easier. And for most people, it doesn't take a whole lot before things start to get better. So that would be my recommendation for most people. So I guess with the last couple of minutes, just wondering if there are any final questions. I think for the most part, it sounds like people are just wondering about, how do I even know if things are not going well? Or, is a psychologist where I need to go? And, the answer is that it's not for everyone. It's not necessary for everyone, but it's also not your stereotypical lay on a couch and tell your deepest, darkest secrets to a psychologist. This kind of situation is a lot more based on, let's find strategies to help you feel like you can move forward in your life, or help your child move forward so that they can live their life as happily as possible and as easily as possible. And again, it does get better for overwhelmingly almost every single person. It gets hard for a bit because it's challenging and it's a lot to cope with, but then it gets a lot better. So that's the biggest take-home message for you is, don't give up. You're not alone. This is very normal. It's a struggle for everybody when they first learn about this, when they're first dealing with this. And in the end, if you are proactive and you try multiple different coping strategies when you need it, how you need it, most people find that they can be very successful. And in the end, you can have a very happy, healthy life, and your child can have a very happy, healthy life. In our program, we have several people who work with us together, including myself, who have celiac disease, and we are able to be productive members of society and able to say, it does get better, and it gets easier and easier every day. Is it always perfect? No, but the reality is that luckily with celiac disease and gluten sensitivity, we have a little bit of an answer. We know that okay, if I can remove this from my diet, I will feel a lot better. And that is a big advantage. You know, a lot of other autoimmune conditions are much more complicated and much more unpredictable. So as much as it's a burden, it's also, you know, I think it's very fortunate that you can understand what the problem is and be proactive about trying to keep yourself healthy. So it's just thinking about the way you want to approach things that can really affect how things go. So on that note, I'm going to thank everybody. And again, don't hesitate to reach out. And I'll be doing this again, the same topic, just another question and answer session in another month. And we'll be sending out, actually a little less than a month now that I think of it, I think 3 weeks. And we're going to also have some other topics coming out as well in the future. So we'll be sending out announcements when those are all happening in the future. Thanks, everybody. Have a great night.